Pose your questions and answers in the Q&A box. You may also provide any introductions and reflections in the chat box. We look forward to hearing who's joined us today and to hearing some of your concerns. The webinar will be recorded and is being recorded right now. It is also being streamed live on YouTube. Just to provide a brief overview of why we are here today. Obviously, this is one of the pre-summit sessions for the UN Food Systems Summit. We're very pleased that there has been an opportunity for this pre-summit to take place to really start to distill some of the myriad critical issues that are coming forward and that will be taken forward in terms of action at the Food Systems Summit at the time of the UN General Assembly in September. Just as a reminder, over half the world's population suffers some form of malnutrition, and 2 billion people in the world cannot afford a healthy diet. All forms of malnutrition, that is undernutrition, overweight and obesity, and micronutrient deficiencies, are being exacerbated by COVID-19. Inequity in food systems is felt hardest, as we know, by the poorest, and particularly impacts women. So we will be hearing a perspective around that as well. COVID-19 is also disproportionately affecting people living with overweight and obesity, while also driving, in some instances, increases in weight and BMI as a consequence of lockdown. 130 million additional people are now experiencing extreme hunger due to COVID, resulting in thousands more children dying from undernutrition every month. So we are really seeing a collision in a very heartbreaking way between COVID-19 and food systems. So this event will explore interactions between food systems, different forms of malnutrition, and gender, highlighting some of the key double and triple duty actions, that is, again, solutions that can potentially positively affect all three forms of malnutrition, which we want to be elevated by the Food Systems Summit. The objectives of the event, just to be clear, are highlighting the importance of healthy and sustainable food systems to prevent and treat all forms of malnutrition, and treat is a very key element of that for all forms. To increase understanding of the double and triple burden of malnutrition in India, and for India as an example of the world, to elevate examples of double and triple duty actions that can be taken to deliver health for people on the planet. And that is linked in part to the global syndemic of obesity, undernutrition, and climate change, which was the Lancet Commission report that launched 2 years ago, pre-COVID, believe it or not, that was looking at how interrelated the food systems and climate change are, and how there are double and triple duty actions that can be taken to address all three. We also want to address some of the paradigm of responsible consumption, which is one of the recommendations that's coming forward from the Food Systems Summit preparatory activities that have been taking place over the last year, and just perhaps ensure that we don't end up with a definition that's not useful. Responsible consumption as a model is useful, and it certainly is helpful for the private sector. We have concerns that responsible consumption will wind up being oversimplified and left to indicate that the responsibility is all at the individual level, and indeed that's in many ways the blame is as well. So we want to really challenge and see how we can address that and come up with positive ways forward. And again, finally, we want to call on the UN Food Systems Summit to promote more strongly government-led systems-based actions to ensure access to nutritious foods for those that can't afford the smart choices, and really for all. It's my great pleasure. We have an extraordinary group of panelists today. First, we have Professor K. Srinath Reddy, who is president and I think founder in a way of Public Health Foundation of India, formerly head of the Department of Cardiology at All India Institute of Medical Sciences in Delhi. Under his leadership, PHFI has established 5 Indian institutes of public health to advance multidisciplinary public health education. Dr. Reddy has received numerous rewards, is a visiting or adjunct professor at several universities, including Harvard School of Public Health, and is past president of World Heart Federation, and was instrumental in much of the health agenda for the Sustainable Development Goals. Arjan de Wacht is with UNICEF India as Chief of Nutrition. He's been in that role since 2017. Professor De Wacht is a native of the Netherlands and has over 25 years of experience working in nutrition, including 20 years with UNICEF. He has a master's degree in nutrition from Wageningen University in the Netherlands and has worked across many countries in Africa as well as in UNICEF New York headquarters. I should add, Dr. De Wacht is only available till the half hour, which here in Boston is 8 a.m. and will be 2 p.m. Central European time, and I believe 5:30 India time, if I'm not mistaken. And then finally, we have Mr. Pat McMahon, who is a registered nurse and established Mothers First in 2004. This is a field-based organization that targets food-based interventions to malnourished pregnant and lactating mothers in India. And he is going to tell us about the interplay between food systems, gender, and nutrition. Right now, it's my great pleasure to introduce Arjan De Wacht, who will be letting us know about key findings on a new study on child overweight and obesity, as well as undernutrition in India. Thank you.
Okay, can you hear me?
Yes, I can hear you.
And I think you can also see the screen, if I'm not mistaken, huh?
Yes.
Then we're all set. Thank you very much for inviting us at this meeting. I want to share with you the results of a landscape analysis that was done around overweight and obesity in children, and then reflect on that from the more the food systems kind of approach. But before that, I want to highlight also the Comprehensive National Nutrition Survey, probably the largest nutrition survey done in the world. Of course, in the case of India, you always tend to go to large things, anything, including surveys. But not only that, in size and total a number of people surveyed. Unique was here that we looked at all children between 0 and 18 years. And many population surveys, they tend to skip this group between 5 and 15. And we also looked at many different factors, not just the underweight and related factors. There was a micronutrient component, there were behavior, there were aspects around cognitive development, etc. So it was a really comprehensive in many ways. You can Google it, you can see the survey. Just to highlight, indeed, the survey showed that while there's some progress on the reduction of normal child undernutrition, we actually start seeing that, I wouldn't say being replaced, but we see an increasing growth of obesity and of overweight in children. In particular, that seems to start, I'll also show that a little bit later in a bit more detail, from about 5 years onwards. And then, of course, micronutrients. And then you're going to get this complete mix of different forms of malnutrition, because these are all malnutrition, different forms and different combinations in children, in individual children, where one child might be growing well, might even have obesity, but on the other hand, the child might also have micronutrient deficiencies. So just wanted to highlight again the Comprehensive National Nutrition Survey. You can Google it and get the report and several further analysis on it. Now a bit more about the landscape analysis. The landscape analysis was really about what do we know, what is the situation around child obesity, and children here is really 0 to 18 years old. Who is affected, where in the country, is the situation improving or worsening, what are the risk factors, what's the environment that contributes to that? And we really used a mixed methods kind of approach. It was the kind of surveys like the Comprehensive National Nutrition Survey, as I just mentioned, but also the National Family Health Survey 3 and 4, and also some data from number 5 already, literature reviews, but also further stakeholder interviews and further in-depth analysis of secondary data as well. So really mixed method kind of approach to do this landscape analysis. And I want to present some of the findings from it. First of all, here you see the point prevalence. And of course, when you talk about relatively small point prevalence, you do talk about relatively large numbers in the case of India, of course. So a very large number of children actually are affected. And you see that the age, as the child grows older, we see that actually the proportion of children with overweight or obesity is increasing. And on the right-hand side, you see for these slightly older children also that actually that micronutrient deficiencies are very common. And actually the difference in micronutrient deficiencies is not even that different from well-nourished children. So in overweight children, the micronutrient deficiencies are almost as frequent and as common as in good nourished children 10 to 19 years old. So really this double burden that we see there. The spread through the country, and here we use NFHS5 data, and keep in mind that the white parts are those states for which we didn't have NFHS5 data yet. There's some data for the 0 to 5 group, of course, from NFHS4 as well. But anyway, I just wanted to show here, it is really spread around the whole country. If you do look at the NFHS4 data for the 0 to 5, you see that places like UP and Bihar tends to be a bit lower. At the bottom of the country, at the south of the country, the prevalence is higher. But at the same time, also, probably more important, besides the point prevalence, also the change between the NFHS5 and previous surveys. You see that actually in most parts of the countries, and this is a trajectory we've seen since NFHS3 at least, there is this continuing increase of overweight and obesity in the youngest children. Oops. Now let's zoom a little bit further. Which groups? Of course, as you would expect when it comes to overweight and obesity, among the richer children, it is more common. But you also see it among poorer children. Actually, it's interesting. Even with undernutrition, we see the same. We see that if you take stunting, you see that maybe about 20% of the children in the richest quintiles are also stunted. While it might be 50% in the poorest quintile. Yeah, so poverty does lead more frequently to stunting than when you're richer. You still see that it affects all age groups. And for me, this is a very important point because that seems to suggest it's not just income. There are many other factors and probably social factors, behavioral factors. And at the end, when we talk about food, we talk about eating and diets. We see difference between urban and rural, limited differences between boys and girls, in particular at a younger age. Again, also here, again, this is CNNS data. So for this larger age group, the spread in particular, you see it more, as I said earlier, in the southern states. When you look at where are the increases, you see that there's a relatively larger increase, a quicker increase in the rural areas and in the poorer populations. And of course, we even know that also from industrialized countries, you see quite a bit of obesity and overweight, not necessarily in the richest people, but actually in the poorer populations as well, because yeah, they often eating healthy and nutritious is also, for many people, actually expensive. Then, of course, we have got things like COVID further affecting the situation. It also came out, for instance, when people talk about children being stuck behind the screens. And that was also confirmed, not the COVID part, but in the middle part, the CNS data again, that activity, outside activity, is really going down from the age 10 to 19, while actually screen time goes up. And consumption of junk foods, you see it very frequently in the overweight children. As already mentioned, we were very worried that COVID might actually have worsened this. There is no proper data on this yet about COVID. Some people suggest that actually you might have a more further expansion where on one hand, you might have more obesity, but at the same time also undernutrition might actually have increased further. So if we now look at what is required in the different parts, first of all, national targets and policies. This age group 0 to 9 years seems to be missing out often in the national policy framework when it comes to child obesity and overweight. We need to look at also the food-based social protection programs. And for those who are not from India, India has quite a number of social protection interventions where feeding or food ingredients are being provided to specific populations, often the more vulnerable ones. But some of them actually are high in sugar and oils. So actually it would be good to look at those programs and adjust them, in particular for some of these groups. Also, a lot of work has happened in the last years. Ministry of Health, the Food Safety and Standards Association of India around school health, promotion of school nutrition, healthy eating, public awareness, etc. So there's quite a bit of activities ongoing, but at the same time, not everyone is being reached. And in particular, when we talk about school health interventions, schools have been closed for the last 16 months, basically. So there's a big gap because of COVID as well. Then we have to look at the taxes and legislation. There's some work, some experience from some parts of India, in particular Kerala, that we should learn more from. We need to look again at food package labeling, but also menus in eateries, in canteens, school canteens, etc. Other parts of the legislation we need to look at. The markets, yeah, we need to study the markets further and see how things are developing. For instance, you see that confectionery increased almost 10 times in the last few years, the sales of confectionery, and 10 times more than that of pulses. So you see that indeed the sugary, the fatty, the unhealthy foods, a significant increase in sales. And last but not least, also the people. We need to look at, do people actually understand? Do people even know what healthy eating is? And programs like the Eat Right India, investment by the Ministry of Health, Ministry of Women and Child Development are there. But again, is it really reaching all those that need it? Which brings me to about 5 broad multi-stakeholder kind of interventions. And I want to mention the multi-stakeholders because this is not a health issue. It's a social issue. It's a policy issue. It's a multi-sector kind of issue. And that's where we need to look at to bring these sectors together and have one coordinated effort to look at the different components. More investment is needed in what I would call nutrition literacy. At the end, prevention of undernutrition, overnutrition, micronutrient deficiencies have got to do a lot with understanding, awareness of the population. But if people are not being told, if they're not understanding it, then of course you can't expect them to change. So we need them to help, and the government needs to invest more in improving nutrition literacy. We need to have enforcement and full implementation of the policies and enforcements of laws and legislations that are already there. Yeah, so while we keep updating them and improving them, there is already a lot on the ground, and we need to get at state level that monitoring, that reporting being done. We need to look at, when it comes to fiscal instruments, what works when it comes to fiscal instruments in the sales of unhealthy food. What works globally? What has worked in parts of India? And how can we use that instrument to further promote healthy eating? And then we have to look at learnings. Learnings really need to come from India. What kind of programs, like for instance, preschools or school health programs, what kind of programs did work? Why did they work? And how could that be expanded to other parts of the country as well? So again, a multi-sector approach required, addressing different aspects of the whole food chain, from production all the way to consumption and everything in between. And at the end, that will only be the way how we can stop not just undernutrition, but also overnutrition and actually all forms of malnutrition in India. I thank you very, very, very much.
Thank you very much. That was an excellent presentation and very interesting in terms of the connections between stunting and overweight and obesity and all forms of malnutrition. I have a couple of questions for you. What sort of based on the trends that you're seeing in India, and I think this is a really important example, what do you think, what would be your key messages to leaders that are meeting today and this week and then in Rome? How could the UN Food System Summit help overcome some of the challenges? What concretely would you ask for based on the recommendations you've just shared?
Yeah, for me, it's 2 forms. First, what I said is multi-sector approach, and we need to look at all these kind of instruments. And countries need to be assisted in weighing, because countries have to make choices on limited investments that they have. Yeah, that's always have to make choices on what kind of instruments in which context will be most suitable. And I expect that even in India, in different states, you will probably get a different mix, depending on the situation, socioeconomic situation in the state on that one. On the other hand, I think the government really need to invest in what I would call nutrition literacy. And that's both for undernutrition and undernutrition. Actually, a lot of the messages would be the same. What you see in India, a lot of people eat to fill the stomach or to get rid of hunger. And that might actually mean also eating unhealthy, and unhealthy can even lead to obesity as well, as it can lead to undernutrition. So for me, it's really those two components, recognizing that government will not solve undernutrition or malnutrition. Yeah, people cannot do it alone, and it's really this bringing these two together under leadership of government and through our additional investment that you can make that change.
And my only other question, thank you, that's excellent and really helpful and I think succinct, which is important. Sort of multi-stakeholder is a key piece as well. But do you think that based on your experience, do you feel that where do you feel India is in terms of childhood overweight and obesity relative to other countries? Do you feel that this is a trend that other countries are, obviously there's being a shift, there's very much an increased sort of incidence of childhood overweight and obesity in many states in India. Is this something that is, you believe is taking place in other countries, that there are different places along that timeline, particularly other low and middle income countries?
Yeah. No, you see a variety between countries. Quite a few Latin American countries have started recognizing the problem of obesity, I think, a bit earlier. Yeah, and have got more programs. Of course, also, if you look at the epidemics, I mean, maybe India is still at the starting point. Of course, the numbers are staggering just because the population is large. But you do see somehow partial replacement. It's not a full replacement, partial replacement. While you reduce the undernutrition, you start seeing the overnutrition increasing. And we know this from many other places as well. I think that India is still at the beginning stage. And that's why you also see that it doesn't get as much attention. The government launched the Push in Abidjan, a nutrition mission 3 years ago. And that was entirely focusing on undernutrition. Of course, a large number of children are affected by undernutrition. But we need to start bringing these together. And that's why, again, as I said, increasing nutrition literacy. Do people realize that what you eat does something more in the body than getting rid of hunger at that specific moment? And I think generally the awareness is too limited to build a foundation, even for acceptance for other kinds of legislations or policies.
Thank you very much. Thank you for your presentation. I know that you're going to need to leave in about 7 minutes. If people do have questions for you, please do post them in the Q&A section, and we'll try to answer them and share them with you afterwards. And I also do want to remind people this session is being recorded, so you can obtain this afterwards, including your excellent slides. Now, so thank you very much, Dr. Aryan. And now it's my great pleasure to introduce Dr. Srinath Reddy of Public Health Foundation of India, who will take forward this conversation in looking at the life course approach for nutrition, overweight, malnutrition in all its forms. Thank you.
Thank you very much, Johanna. I think the presentation of the data by UNICEF has been very instructive. It tells us that it is not useful to have compartmentalization of malnutrition into 3 distinct and somewhat mutually exclusive categories of undernutrition, micronutrient deficiencies, overweight, and obesity. There is a considerable degree of overlap that we see. Indeed, these can coexist in the same country, in the same age group, same families, and indeed, even in the same person. And in the same person at different stages of life, but also at the same period of life. So it is not useful for us to really demarcate and distinguish these categories as though they were very, very different. We recognize that this is a legacy of the time when the nutrition world and the policymakers were looking at energy adequacy. They looked at nutrition entirely as a matter of supplying enough calories, but not in terms of supplying an adequate mix of calories in the right amounts, in terms of the nutrient composition. Therefore, it is the nutrient mix that really matters, and therefore it's the nutrition adequacy rather than energy adequacy that we need to be really looking at, or if you want to call it a nutritional security instead of food security. And the moment we change that particular conversation, then we understand the problem of overweight and obesity much better, that they do indeed overlap substantially. There is also a link between undernutrition and obesity, not just between micronutrient deficiencies and overweight and obesity. We recognize that across the life course, you can have a person who has been conditioned in terms of metabolic programming because of undernutrition to respond with a gain in body fat and a greater distribution to the abdominal fat later on when they start consuming even what would be considered a normal amount of calories. And that again comes from an inadequate and improperly configured nutrition, because this metabolic programming can be quite challenging indeed. Therefore, again, that emphasizes that at each stage of life, we need the right mix of nutrients in adequate amounts. And it is the nutrition that provides this continuous thread as a link, starting with preconception, pregnancy, going into early childhood, then traversing through adolescence, adulthood, and elderly years. At each stage of life, people will require the right kind of nutrition in the right amounts. Now, it is that thread of nutrition that demarcates between health and wellness, and between health and wellness on one side and disease and illness on the other side. Therefore, we must recognize that in India, there is a particular problem. Because of the legacy of undernutrition of adolescent girls, of pregnant women, of small weight babies being born to them, and also suffering undernutrition in early childhood, you tend to gain a lot of body fat. And that results in what is called metabolic obesity, which is not necessarily distinguished by the conventional definitions of obesity, but can be metabolically very dangerous and have the same consequences as obesity in other populations. And we have seen this with early onset of diabetes, what is called type 2 diabetes occurring even in the early 18, 19-year-old age group, or even the 20-plus age group. We are seeing cardiovascular disease in the very young, and all of this is a result of improper nutrition resulting in excess body fat, which is mostly distributed abdominally. And therefore, we recognize that obesity has origins in early life undernutrition. And this is, again, logical because fat is a reserve source of energy. If you have a fair amount of muscle, then that uses up the calories and energy very fast. Therefore, an undernourished child is metabolically programmed to store the energy as fat, which is more for slow release for bad times, rather than immediately utilize it. And this interplay between nature and nurture begins also with dietary diversity and diet quality for the mother, as well as for the child and as for the adult as they grow up. Because we recognize that there are epigenetic modifications. The expression of genes is considerably altered by the state of nutrition, even though the genetic structure is not. And these epigenetic changes can even be transmitted intergenerationally. If an undernourished mother has a girl fetus in her womb, then the ova or the eggs of the girl fetus themselves can be affected by epigenetic changes. So it is not only the child yet to be born, but the child yet to be conceived who can suffer the consequences of poor nutrition and develop this kind of metabolic obesity across 3 generations. We also know that the nature of food that we eat is also important for the friendly gut flora that we harbor in our body in trillions. And this is the microbiome. And therefore, it's not just what pleases our palate, but what our friendly bacteria relish in terms of their nutrition that matters when we talk about nutrition. And all of these are essentially dependent upon the kind of dietary diversity and dietary quality that we have. But unfortunately, dietary quality and dietary diversity are being substantially influenced and distorted by market forces of production, processing, pricing, distribution, and promotion. We recognize that crop diversity is needed very much for dietary diversity, but commercialization of agriculture with monocropping or emphasis on commercial crops rather than on nutrient crops can be quite devastating in terms of its impact on nutrition and can set the stage for this multiple forms of malnutrition, which, as I said, are actually confluent with each other. Then we see ultra-processed foods and beverages flooding the market, and they provide empty calories laden with sugar, salt, and unhealthy fats in large amounts. And these calorie-rich but nutrient-poor foods can be highly inflammatory to the body. And we know that fat tissue is also highly inflammatory. And therefore, this whole combination of gathering fat, which can be inflammatory to multiple organ systems in the body, is actually a marketed malady and an advertised addiction of unhealthy foods. Here, the question is often posed that it is consumer behavior that matters, and it's consumer choice. It should be left entirely to the market forces and the individual consumer's choice. But I would like to argue that choice can be conscious, conditioned, or constrained. Conscious based on the right kind of information or the wrong kind of information. So we need good nutrition and health literacy. It can be conditioned by market pressures and all kinds of unethical promotion of unhealthy products, by peer pressure that is created. And therefore, we need to ensure that promotion of unhealthy foods is curbed in terms of the advertising and promotion practices, which are targeting children, but also targeting adults and can lead anybody astray. But more equally importantly, the choice can be constrained. You may have all the knowledge in the world, consumer education, nutrition literacy, but if healthier foods are costly and unhealthy foods are cheaper, that's what your pocket permits you to purchase. Whether it is edible oils or whether it is fruit and vegetables, you may not be able to make the healthy choice because you're economically constrained. Therefore, we need multiple levels of action at the policy level in order to ensure that we can create conditions where people can make and maintain healthy living choices across their life course. And then we recognize that policies are also important because now we are challenged with climate change. And therefore, we are looking at the need to promote climate smart and climate resilient agriculture. And this has come up from the Global Panel on Food Systems, Agriculture, and Nutrition as a strong recommendation. Then we also require more plant-based diets. Not that animal foods are totally taboo, but overconsumption or inappropriate consumption of those can be harmful, not only for the human body, but for the planet. And this is where the EAT Commission came up, Lancet EAT Commission came up with a plea for more plant-based diets. But again, this depends upon the agricultural practices and the market forces. So we require a multisectoral solution for a multifactorial causation. And we must ensure that healthy foods become affordable and unhealthy foods become costlier. And unless we do that, we'll fail in our mission.
Thank you for that excellent presentation. We have many questions and comments from the chat. So we will, I'm going to ask you to hold on while we have our final panelist, and then we will come back and have questions and answers for the two of you in a few minutes. So thank you very much, Dr. Reddy and Pat. It's a great pleasure to introduce you and to hear more about your fantastic work with maternal nutrition in particular in India. Thanks.
Yeah, first of all, thank you for two really amazing and informative talks on overweight and underweight. I was particularly struck about the fact that micronutrient deficiencies in underweight children and overweight children are more or less the same. And I think that is key to our understanding. And I think goes to what Dr. Reddy is talking about, the siloed approaches of the different forms of malnutrition. Because I think the reality is that in terms of overweight, certainly in India, I think there is a perception that if you're overweight, it's a sign of affluence and it's not necessarily a bad thing. And I think we struggle with this in the West as well. In the West, if we were to say, Ireland, my own country, is one of the highest rates of child obesity in Europe. Yet if you told parents they're actually malnourished, we would say no. So I think a lot of it has got to do with the narrative that we say and we put out. And I really liked the idea of messaging nutrition literacy. And as as was pointed out by UNICEF, that the fact that the messaging the same messaging would be able to cut across all sectors, whatever type of form of malnutrition. So I was particularly struck with that, mainly because I think this is a cost-effective, achievable solution. Now, some of the programs that our main program is, and it goes back to this nutrition literacy, is we target malnourished pregnant mothers during pregnancy and lactation. And the reason that we do this is clearly the low birth weight and fetal malnutrition are playing into the spectrum of malnutrition. But interestingly, when we did a survey to look up of our work, and we asked the participants who had been on the program before, and we saw that maybe 50% of the food that we were giving was shared, because clearly the households are food insecure, and a mother's natural instinct is to give more to her children and her family. That's what makes her a mother. What was interesting is that we changed our nutrition messaging. So we very much focused on, we're giving you this food because you're malnourished, because you're pregnant, but actually the main beneficiary is not you, it's your unborn child. And that our aim is to increase the birth weight. And we saw that particular messaging increased the food that we were given, the consumption, from 50% to 80%. So we thought that was really significant, just the way that we could messaging can change people's kind of thinking. And I think it's a really, it was really powerful. I think in the practice session we had on Friday, I said we could do a Zoom, we could do a full webinar just on Dr. Reedy. Absolutely fascinating. Absolutely, I'm enthralled by Dr. Reedy for a couple of reasons, to be honest. I've worked many years in the field, and many of the things that Dr. Reedy has said present a real understanding of what things are like in the field, and the dynamics around food affordability, and the dynamics around consumer choice. And the reality is that for many, food affordability means that cheap food, high calorie food is what they can afford. And like I'm always struck by, when I'm in India, that they'll have a huge plate of rice and a little bit of sabji, a little bit of veg, a little bit of dal, and it's to fill the stomach and to feel full. But because food is relative in these countries, I think you said it, Joanna, like 2 billion people cannot afford a healthy diet. And I think we very much work on and it's the same Dr. Reedy talking about the life cycle. And we have seen that. We've seen children going through our program, going from underweight, going from underweight to surveys 4 or 5 years later, and seeing, well, actually they're kind of overweight. They've got past that barrier. And initially we thought this is a success. We've done something. And then we realized what Dr. Reedy is saying is that metabolic conditioning. And I suppose that our emphasis, we would say, is around, but women are disproportionately affected by malnutrition, and they're between anemia, overweight, underweight. Even global hunger statistics show that women are disproportionately affected by hunger. But the implications of their malnutrition status, be it overweight or underweight, has a life cycle approach and has the intergenerational cycle of malnutrition. So I think looking through the policies and what we could do, I think clearly, and we know what to do, but particularly we would say, and it's clearly we have nutrition sensitive and nutrition specific, and both have a place to play. But ultimately, the direct nutrition interventions for the most marginalized are helping people meet people's immediate needs. And I think it's disappointing that for us that the Lancet, the essential nutrition actions outlined by the Lancet, that they haven't been, since 2013, 8 years ago, we still haven't scaled up these particular interventions that we know has the evidence base and are cost effective. So I think if we were looking at policy, we would be saying, because we need to look at the poorest, the furthest behind. So I think, that takes direct nutrition specific interventions, holding under the broader umbrella of nutrition sensitive. So I think that's all we'd like to conclude our remarks at that.
Thank you so much, Pat. Those were excellent remarks. And Dr. Reddy, I'd ask you to put your camera on again too, because I'm now going to, of course, we are short on time, but we have a number of questions which I'm going to try to distill into a couple if possible. Really excellent remarks in terms of compartmentalization, the idea of not shifting from food security to nutrition security, and Pat, your points about the disproportionate burden on women, on mothers, is a very, very important piece of this, and very much the way the obesity pandemic starts in terms of disproportionately affecting women as well. So first of all, for Dr. Reddy, I have a question, which is I think you've alluded to some of this, but just to re-articulate, how will policy interventions help to contain and control the emerging epidemic of overweight and obesity? Well, not emerging, the epidemic of overweight and obesity in low and middle income countries in general.
And thank you, Johanna. While promoting nutrition and health literacy in individuals is important, policy will achieve results much faster over the population level. It will have a population-wide impact. It is also likely to be cost-saving in very many ways because of the extent of the impact. And it will also have intergenerational benefit. If you create healthy food and agriculture systems, if you create healthy marketing mechanisms, and you create opportunities for good physical activity as well through urban design and urban planning and transport, these are going to be a legacy not only for the current generation, but also for the future generations to come. And therefore, there is a huge intergenerational benefit which is not costed and accounted for by the health economists. And we should take that into account. At the population level, we do need to create a conducive environment even for individuals to make the right choices. And these will involve fiscal instruments which can actually ensure that healthy foods become cheaper and unhealthy foods become costlier, and we can use taxation as a very important instrument, supplemented by subsidies as appropriate for the healthy foods. At the same time, we need regulation of advertising and promotion so that unethical promotion of products, but not only to children, but even to adults, because the family is really indivisible when it comes to exposure to advertising. We need to ensure that that is curbed. We need product regulation as well, whether it's salt, sugar, and fat, unhealthy fats, the trans fats, all of that, we need the product composition to be regulated. Then we need urban design, as I said, for promoting physical activity. And there are many co-benefits of these policy changes because they'll also help us in reducing our march towards global warming and help us slow down climate change very well. To me, policy is like a carrot and a stick approach. You need to use incentives as well as disincentives. I would even call it a frozen carrot which can be used both as a carrot and a stick in the right manner.
Okay, so the carrot, depending on the temperature, is the key. Thank you. So Pat, there's questions about, very interesting questions about the issue of human resources for nutrition, and even the idea of a sort of a minister of nutrition, or what is the right structure. And I'm curious, just based on, how does that align with your thinking about what's most needed, and with this wider conversation we're having about the need for a multisectoral approach? Is this great? Do we have greater accountability, or do we risk creating another silo that doesn't, that has different incentives from maternal and child health silos, or other silos that are playing a role in this situation?
Yeah, thank you. That's a great question. I suppose, the Sustainable Development Goals is centered around the premise of not to leave the furthest behind. And they have the furthest behind first. So I think it's really important when we're looking at policies and actions that we understand who are the furthest behind. Now, our experience in the furthest behind, many years in the field, is that regardless of context, the furthest behind will always be women. In every context, whether it's development, whether it's a Western setting, whether it's conflict, they'll be women. And equally, we know that women are disproportionately affected by the outcomes of a food system, either underweight or overweight. And clearly, during pregnancy is the most vulnerable time that a woman, because she's bearing us into the world. And thank you very much. The way we're treating women now is a real issue. They're our mothers, and yet they are the furthest behind, and they're child in utero. So I really think we need to jump the narrative first on who is the furthest behind, who do we need to target first, and bring them up. So that would be my rounding question. My rounding answer to that question is identify who's most in need, and understand that who's most in need within the food system. Their right to food is inherently restricted. Equally, their right to life is restricted. Equally, their right to an education, because the cognitive implications for both obesity and underweight. It's not just like Dr. Reedy saying, it's not just one or other. All of these things cut across the board. So I think that's where we would say, identify who are most in need, and develop policies around this issue. So a minister for the furthest behind would be a
minister for the furthest behind would be a very interesting model. And then making sure that what doesn't happen is a bit of what's happened with food, which is that yesterday's solutions become today's problems in a way, when the focus had been so much just on sort of energy alone. That's contributed to some of the shift towards overweight and obesity. But really, really good points. Thank you. We are really out of time. I'm almost. I'm going to ask each of you to say if there were one key message or a couple to the leaders that are meeting today in Rome, what would that be? And I'm also just want to, before you provide your answers, I want to acknowledge that there's some fantastic questions in the chat and in the Q&A, and I'm very sorry we're not able to get to them all, but what we will do is respond to them. We will do written responses to them, calling on our panelists, and then that will become part of the recording that we share with those who participated today and with others. So because there's really good, important questions about technology, about politics, et cetera, about the effect of the pandemic on nutrition awareness and literacy. So for now, I'm going to ask you to just sort of summarize and to say what are your key messages for the leaders in Rome. We can start with Dr. Reddy. Thanks.
Well, my message to the policymakers is correct the present and create the future. You have a unique opportunity to do that. Create the broad vision, but then decide on how best you can have focused implementation of the different components which are going to be complementary and synergistic in their impact. So make sure that you have a good combination of the political will as well as the professional skill to carry out the implementation as well.
Wonderful. Okay, thank you very much. So correct and create using carrots and not compartmentalization, perhaps. Thank you, just to keep the C's going. Pat, what would be your statement or request?
Yeah, I think we need to judge a food system by its outcomes, and the outcomes are what we're consuming. And I think if you look at the analysis, very little structure has been put into and thought into the implications of a failing food system, such as overweight and underweight. And if we don't understand the problem that we're trying to solve, then we're shooting kites into the sky, because it's not. So I think a greater emphasis on consumption and the outcomes of consumption, and focus on that. And from this platform, then we look at the solution base. What are we trying to achieve?
Great, thank you. So looking at consumption and then understanding hopefully the upstream drivers of that consumption so that we can help to shift that pattern. Any final thoughts or remarks before we close? I want to really thank you for being extraordinary speakers. And this was a really eye-opening, interesting, and I think important session, very much reflected in the feedback that we're getting from the chat and the Q&A and our own reactions. Any final thoughts or comments? Pat, I'll come back to you. Do you want to say anything additional?
I'd like Dr. Reedy. I'm absolutely fascinated by Dr. Reedy, so I'd like to, Dr. Reedy.
Okay. So Srinath, you will have the last word.
Well, we have not mentioned the other twin of overweight and obesity action, that is physical activity. We do need to promote that as well. But just to leave you with the thought, if you have a lot of body adiposity, even if you're not overtly obese, and less of muscle mass, because the body is already trying to create fat as a stored deposit and is trading off muscle for fat, then you're unable to be physically active either. Therefore, nutrition creates even that vicious cycle, where not only is it creating metabolic abnormalities, but is preventing you from becoming physically active. So nutrition is absolutely the key, but we must also couple it with adequate physical activity and ensure that overweight and obesity are fought on all fronts.
Great, thank you very much. And it's our hope that that the challenges of COVID will alleviate over time, so that we've been robbed of many opportunities for safe physical activity during this past 16 months, and sort of pray and hope that this will improve in the coming months and years. Thank you very much for what I think was a really excellent and important session. I think distilling lots of good thinking, great frontline experience, activity over many years. And so it's been an honor and a privilege to be part of this and to help moderate today's session. Again, we will have this available as the recording available, and we will also provide some responses to some of the very excellent and comprehensive questions that were posed. Again, thank you. We wish everybody, please do avail yourselves of other of the affiliated sessions at the Food Systems Pre-Summit. This is an incredibly important moment. This is not an easy topic, but I think that even through today's sessions, we've been able to come up with some sort of distilled ideas that can work across a lot of the different problems that we're trying to solve here. So thank you so much, and have a wonderful rest of the day or evening, depending on where you are. Thanks again.
Thank you.
I'm guessing we're still live, so we'd probably want to